Hello, this is an informative video on gastroenteritis. Gastroenteritis, commonly referred to as gastro, is a disease that involves inflammation of the gastrointestinal tract, particularly in the stomach, small intestine, and large intestine. The disease can be classified into two groups: infective and non-infective gastroenteritis. Uninfective causes of gastroenteritis are less common compared to infective. Major causes of non-infective gastroenteritis include feeding difficulty, anatomic defects, malabsorption, endocrinopathies, food poisoning, and neoplasms. Infective gastroenteritis is caused by pathogens such as bacteria, viruses, and parasites. These pathogens can be transmitted by other people or animals, or by ingesting the pathogen in food or water. The two most leading causes of bacterial gastroenteritis were Salmonella and Campylobacter, while rotavirus and norovirus are common viral causes of gastroenteritis. Rotavirus is the most common cause of gastroenteritis in children under the age of 5. Inflammation of the digestive system can lead to many symptoms, including abdominal pain, cramping, nausea, vomiting, and diarrhea. Some causes of bacterial gastroenteritis, for example, those caused by Shingler or Campylobacter bacterium, may also involve dysentery or bloody diarrhea. In developed countries, acute gastroenteritis usually resolves within 14 days, with symptoms such as vomiting only lasting a few days. Due to the fact that dehydration is a common consequence of gastroenteritis, the need for rapid treatment is vital for a child's recovery. Children require rehydration therapies, administered in different ways to help regenerate electrolytes and lost fluids. A more expensive evidence-based approach to treating gastroenteritis is intravenous therapy, or IVT. IVT is the rapid restoration of fluids via the veins, carried quickly through the circulation of the body. The treatment is more expensive as it requires specially trained staff and is expensive in terms of money and human resources. An inexpensive approach for the treatment of gastroenteritis in children is oral rehydration therapy, or ORT, first established in the 1970s. ORT is the restoration of fluids which is given orally or by nasogastric. It is common for children with gastroenteritis to receive their fluids via syringes, spoons, or cups, making it easier for them to consume. In order to make it more appealing for children, apple flavouring can be added to combat refusal to consume, with the bad-tasting ORT regarded as a barrier for children. These two methods, the normal and the apple-flavoured ORTs, were found to be effective and interchangeable. The recommended approach depends on the level of dehydration. For mild to moderate dehydration, oral rehydration therapy is most suitable. This is due to ORT being the easier option. It can be performed by anyone with little training and is the cheaper option. For severe dehydration caused by gastroenteritis, intravenous therapy should be used. IVT therapy is most suitable for severe dehydration as it can replace fluid lost and maintain fluid balance. The downfall of IVT is that it requires strict parameters such as correct fluids and administration rate to be monitored. Failure to do so can result in consequences as severe as death. A negative aspect of ORT is that it has a higher failure rate compared to IVT. For every 25 children treated orally, 1 would fail. Failure to rehydrate via ORT results in the patient needing to be rehydrated using IVT.